Hi, I'm Sean Riva, Doctor of Physical Therapy, creator of Rise PT. Movement is life. Plantar fasciitis limits that movement. We need to increase our range of motion and strength to eliminate the pain and to rise. Here's my physical therapy plantar fasciitis workout. Enjoy.
Wrap the TheraBand around the ball of your foot, trying to remove as many of the wrinkles as possible. Straighten out your leg and hold the TheraBand. Point your foot and slowly release it. Here we're working the plantar flexors, mainly the Gastrox, which starts above the knee and connects through the Achilles heel to the plantar fasciitis at the bottom of your foot, focusing on the eccentric loading, which is when the muscle is lengthening under load. That is going to help strengthen the tendons that connect your muscle to bone and the muscle belly itself, as well as alleviate pain and help control inflammation. Progress from yellow, the easiest, to red, to green, and finally blue, the hardest. This exercise is dorsiflexion. You may need a partner to hold on to the TheraBand for you, or you can tie it to a large bed frame or make a knot and close it inside of a door. Be careful. This will help strengthen the muscles that lift the front of your foot, which oppose the Gastrox muscle. Pathophysiologically, when you use opposing muscles, they relax each other and strengthen the ankle overall. This exercise, we're going to focus on everting, moving the sole of your foot and tilting it to the outside. Here, you want to focus on slowly bringing it back to neutral. The next exercise, focus on inverting your foot, moving the sole of your foot to the inside. This time, slowly release your ankle back to neutral. This exercise, the towel scrunch, helps utilize your toe flexors to help create an arch and release binds within the fascia of the plantar surface itself. For plantar fasciitis, the most important exercise, utilizing the slant board. Stand up on the slant board and allow your heels to drop down, stand as straight as possible, and hold on to something. The first progression, you lift your heels, standing on the balls of your feet. Partially use the non-plantar fasciitis leg to help lower your body weight down onto the slant board.
Most plantar fasciitis is from an overuse injury caused by limited strength or limited range of motion in the plantar surface, surrounding muscles, and mainly the Gastrox.
the second progression, you lift your heels and go down only with your plantar fasciitis leg. This is to load the muscle eccentrically to increase the density of the tendons and to hypertrophy, strengthen the gastroc muscle. The first restorative pose, stand on the slant board. As shown earlier, you can use a staircase with 2 handrails. Allow your heels to drop, breathe, stay in this position for a total of 2 to 3 minutes, 20 seconds at a time if needed. We're stretching your gastroc muscle.
The gastroc muscle starts above your knee and connects through the Achilles heel to the 5 metatarsal tendons within the plantar surfaces of your foot. Remember to breathe. The next restorative pose is to massage the surface of the plantar fascia. Use a full foam roll and roll it along the floor using the sole of your foot. The next restorative exercise is to stand on a half or a full foam roll. Make sure you're holding onto something. This helps to form the arch and relax stiff tendons in the plantar surface of your foot, somewhere between 2 and 3 minutes total time. Breathe. The next restorative pose is to massage the surface of the plantar fascia. Take your ankle of the plantar fasciitis foot, cross it over the opposing knee. Pull the big toe back and use your other hand, fingers and thumb to provide linear and perpendicular massage. Should feel like a guitar string, and try to loosen its motion within the fascial compartment to help relieve tension. You can even hold singular pressure on a very tight spot. The next restorative pose is to use a ball, a golf ball, a massage ball, small and progressing to large. Roll it 30 times clockwise and 30 times counterclockwise over the entire surface of the plantar fascia. Finally, often the most rewarding restorative pose is to freeze a plastic water bottle and roll it along the floor using the sole of your foot. Thin sock allows you to not get burned, but allows for the cooling to penetrate deep, reduce inflammation, reduce the speed of signals going up into your brain, causing pain, and allowing you to have a peaceful, relaxing end to your session.
Be kind to yourself. Do this 2 to 3 times a week with days off in between for roughly 6 weeks. Remember how important rest is and wearing the proper shoes for support. You will eliminate your plantar fasciitis altogether. Thank you for doing your session with me today.